On behalf of the Patient Safety Authority, I would like to welcome you to this webinar titled Preparing Nurses for Their Roles as a Clinical Faculty or Student Nurse Preceptor Supports Patient Safety. My name is Kelly Gibson, and I will be your moderator and one of the speakers for this program. Now I'd like to introduce our speakers for the webinar. I'm Kelly Gibson, the Patient Safety Organization Program Director at the Patient Safety Authority. I oversee operations, compliance, and strategic direction of the component PSO, leading initiatives to improve outcomes through collaborative learning, data analysis, and implementation of best practices. Anna is a public health nurse with 20 years of maternal child health experience. She has spent 7 years as a nurse home visitor in Philadelphia and now serves as a clinical nurse educator, supporting both clients and fellow nurses. She is dedicated to helping nurses build long, fulfilling careers in public health. Amy brings 29 years of nursing experience across acute care, home care, rehabilitation, and leadership roles. She directs nursing professional advancement initiatives and supports statewide nurse residency collaborative efforts. Passionate about empowering nurses through education, leadership, and technology, Amy also serves as Vice President of Customer Experience at Ronco Technology Solutions Peak Outcomes. None of the remaining planners or presenters for this educational activity have relevant financial relationships to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. The objectives for today include the team members will be able to describe the cycle by which a deficit in clinical educators leads to fewer licensed practical nurses and registered nurses, and team members will be able to name 3 learning areas that support patient safety in the preceptor-preceptee relationship. I'll start by giving you a little bit of background about what we've seen in the data from the Patient Safety Authority's perspective. This is a little bit of a dated look at the data, but from July 2010 to June 2015, and this was from the article that was published in March of 2016, what we found when we queried this data was that medication errors involving students and was listed in the descriptions, and we found that there were 711 reports to kind of set the tone of at that time in the state of Pennsylvania, there were approximately 85 nursing programs. Currently, just in a quick query, it looks like we're around 100 in the state. There were 7 pharmacy programs as well as 7 medical school programs. In these event reports, with the deeper analysis, what we found was that 16.6% were related to an extra dose administered, 13.2% were dose omission, and then 11.4% were wrong time. The most common care areas, as you can see, are medical surgical, followed by telemetry units. If you are familiar with PACERS, the reporting system, and how events get submitted, there's what we call the harm score. And what that harm score kind of looks at is, did the event reach the patient? And if so, what degree of harm resulted for the patient as a result of that event? 87.3% reached the patient, not contributing to patient harm. Only 0.6% resulted in some degree of patient harm, with 0 resulting in permanent harm, near death, or death. Again, just a little bit of kind of what are we seeing here with those reports. Primarily, a lot of them were involving nursing. 84% of those reports were nursing individuals, followed by pharmacy and medicine. They also, a majority of them, 69.8%, occurred during the peak academic period. So you can see the months that are listed, and those really correlate to the academic timeframes and the semesters within those programs. So as you can see, that data is not necessarily in line with what we're talking about, except that it gives you context about we're seeing medication events that correlate or show there's opportunity related to learning capacity surrounding novice or new healthcare clinicians. So what opportunities and how do we best support them? Amy, I will turn the program over to you.
Thank you, Kelly. Really appreciate you connecting that dot between what we've seen in the data regarding our undergraduate nursing students and really why, one of the reasons why what I am here to share with you was developed. So I'm going to spend the next few minutes giving you the groundwork as to why HRSA supported a grant for clinical faculty and student preceptors, and this curriculum was originally developed. So this was in partnership between Geisinger. Many of you are familiar with the academic medical center, Geisinger, its School of Nursing, the Pennsylvania Nursing Workforce Coalition, and the National Nurse-Led Care Consortium. It was this partnership that created a curriculum that is the result of a 4-year HRSA grant. So a little bit about Geisinger. Geisinger is a regional healthcare provider in Danville, Pennsylvania. The National Nurse-Led Care Consortium is a nonprofit member-supported organization that is vision is to strengthen community health through quality, compassionate, and collaborative nurse-led care. While the Pennsylvania Nursing Workforce Coalition was most recently established in 2011, moved under the National Nurse-Led Care Consortium in 2014, and houses the State Nursing Workforce Center. So you can see why the development of this curriculum is really working within the mission of all three of these organizations, and why each one was passionate about coming together and creating what we're here to share with you. For those of you who might not know, there are 10 HRSA regions in the nation. And as part of Pennsylvania, you are part of HRSA Region 3. So here we have Pennsylvania, Delaware, Maryland, West Virginia, Virginia, and the District of Columbia that make up our region. And that is specifically the target of the work that was done. The grant objectives were to increase the nursing workforce by not only recruiting, training, and producing skilled, qualified nursing faculty and preceptors to address our health equity, increase access to care, and increasing the capacity of the healthcare workforce. I know I don't have to go into the details of why we all know that is important and it is an issue, but this preparation of newly hired and transitioning licensed nurses in no matter what the setting. So it's not just acute care. We're looking at rural settings, home care, you name it, as long as we are looking at where those undergraduate nursing students are in their clinical experience, making sure that the faculty and preceptors who are working with them are prepared well and making a difference in the overall outcomes for those nursing students. So again, I won't go into the details of why we all know this is important. The fact that lack is our largest word in our word bubble is probably why you're all here, and understanding what we're missing. And this grant was funded to fill one of those gaps. So we know that there's a lack of preceptors in the time perspective, that everything occurs on the job, and many of our clinical instructors have other jobs. The impact is that we have a shortage of prepared instructors and preceptors, and that they're not often oriented to the role. It's, you're a great nurse. Hey, don't you want to precept this nursing student? Or you're a great nurse. Why don't you become faculty at the university down the street? Because you would do really well at that, but not really appreciating that there is a unique skill set as to how to educate. And then money, which is, we can all appreciate the money concern, but many preceptors don't receive extra pay. And that we are very aware that clinical instructors are not on par with clinician corporate pay. So the target audience for this grant was healthcare organizations, academic institutions, and individuals. So we really were running the gamut here, and created an advisory board made up of just those target audience groups to guide where this curriculum went. So because we were looking at those diverse practice areas, we wanted to make sure that we incorporated all the pathways, all the considerations around geographic locations and the idiosyncrasies that we know reside in that, and also making sure that we were representing all the populations that we have in HRSA Region 3. So the logistics, as I mentioned, it's a 4-year grant. We are currently on the cusp of entering year 4. First year was our ramp up, and this was the hiring of the amazing individuals who help make the curriculum, not only develop the curriculum, but make that curriculum come to life. And Geisinger was really the root of all of that, along with the National Nurse-Led Care Consortium and the Pennsylvania Nursing Coalition, Workforce Coalition, was the group that put together the advisory board. So the advisory board was being created. We then vetted the curriculum, made adjustments, and in year 2 piloted that at the Geisinger facility. Really tremendous, as Anna is about to share with you, reception from the Geisinger nursing group, and worked out some kinks, developed a toolbox, knowing that in year 3, that was going to be our rollout to individual facilities and individuals to, again, work through those kinks. Year 4 is, again, even wider distribution, which is why we're having this webinar, to share with this group not only what is available to you as part of HRSA 3, but also to know what has been created and the impact that we're having. So with that, I am going to pass this presentation over to my colleague, Anna Fry, who will review the curriculum and course overview.
Thank you, Amy. And I thank you for going over how we got here. I'm going to go ahead and let you all know what was developed. So this curriculum design is truly innovative. It was designed using interactive, unfolding longitudinal case studies in which essential learning concepts and specific exemplars are presented to the learner. The content areas were driven by input and suggestions from the advisory board members that Amy mentioned, and the input was gathered over the first 4 months of 2023 through monthly advisory board meetings. After compiling all the information from the advisory board, it became clear that the suggested content was very much aligned with the NLN's blueprint for the Certified Clinical Nurse Educator exam, and this then became the guiding framework for our course goals and objectives. As the learner progresses through the course modules, they follow the cases of several novice and experienced clinical faculty members and preceptors. The learner is also introduced to peripheral characters in these case stories, including nursing students, faculty members from schools of nursing, as well as staff and leadership from the clinical institutions where the main characters are serving as nurse educators. The learning concepts driven by each module's learning objectives are embedded within the case stories, addressing not only educational concepts, but also touching on the important and often complex interactions occurring in the clinical environment between students, faculty, academic, and clinical institutions. Course content is broken into 6 learning modules. Each module is built around a case story of a particular protagonist who interacts with other characters as he or she navigates the role of clinical faculty or preceptor. The storylines were created to associate directly back to the learning goal and objectives of each module. There are links to multiple resources within the module, some of which we created ourselves, and others which are links to open access resources from the internet, or to resources for which we obtained copyright permissions. Our primary curriculum author and instructional designer collaborated to create options for learners, where they have the choice to access various versions of content suited to different types of learners. For example, content about managing difficult conversations can be accessed by reviewing an internally created PowerPoint presentation or by watching a linked video. The user has the option to view both resources if they want to, but they'll be able to answer the embedded knowledge check questions accessing either resource. So you can see here are 6 learning modules: basic principles of teaching and learning, effective professional communication, elements of teaching strategies, fundamentals of assessment and evaluation, transition to the novice educator role and faculty identity formation, and emergency and disaster management principles in nursing education. Here are some of the additional concepts that are interwoven throughout the modules. It made sense to have them be active throughout different scenarios because they really covered all the different modules. We didn't break them out into separate learning experiences. But of course, we covered diversity, equity, and inclusion, legal and ethical concerns, in nurse precepting and in being a student or being a clinical instructor, generational differences, especially among learners, self-reflection, introspection, and self-analysis, implicit bias, and communication. Of the modules, there are several which more closely promote patient safety. By clearly educating the learner about the roles and responsibilities, legal aspects of the student and preceptor's roles, and communication among the healthcare team, we are addressing these concerns head on. Fear of liability is why nursing student errors remain largely underreported, and culture surrounding liability has been shown to be more effective than other teaching strategies to reduce medication errors by students. So really, we're addressing both the culture and also specific questions that learners might have about their legal responsibilities as an educator or as a student. Effective personal communication is another area where the CFPA promotes patient safety. The modules give multiple opportunities for the learner to practice professional communication, and the modules model professional communication for the learner. The communication module explicitly addresses how communication affects the patient experience and the safety of the patient and the healthcare team. And as we know from Kelly's part in the beginning, communication is a key factor in medication errors. The last module that promotes patient safety is the Emergency Disaster Management Principles and Nursing Education module. It asks the learner to flex their critical thinking skills and plan a disaster response in a patient environment through role play. Throughout the course, we included multiple formative assessments. For example, each module is preceded by a brief pre-test evaluating the learner's baseline knowledge of the key concepts included within the module. The learner has one opportunity to complete the pre-test. Our learning management system, which is Canvas, which you may be familiar with, is used to record the results and provides basic test item analysis. Then, upon completion of each module, the learner takes the same quiz in the form of a post-test quiz, in which a score of 80% is required to unlock the next module. Users are allowed multiple attempts on the post-test, and our statistics have shown that most users reach the 80% passing threshold on their first or second attempt. During the post-testing, rationales for the correct and incorrect answers are provided. We intentionally did not provide these rationales in the pre-test for the purpose of requiring interaction with the module's content to achieve the passing grade in the post-test quiz. So I've taken this module, and what I can say is that one thing that makes it really unique is that you can't just click through it. A lot of online learning modules you can click through very quickly. This module really encourages your engagement with each and every aspect. In addition to the pre and post tests, there are embedded knowledge checks within each module. And Those you also have to score 80% to progress. And if you make 2 attempts with a score less than 80%, you have to repeat the content. At the completion of all the modules, learners complete 3 brief summative assessment projects, and these are graded by Geisinger faculty currently from the School of Nursing. The first is creating a personal philosophy of nursing clinical teaching and learning. The second is developing a lesson plan for a specific clinical nursing topic. And the third is developing a plan for engaging in a difficult conversation. And I really want to point out that communication is one of the most frequently repeated topics throughout these learning modules, and addressing difficult communication among different participants in the learning environment. Right. At the end of the modules, the learner has the option to get CE credits. So the CE credit fee is $15. The modules themselves are free, but of course, unfortunately, to get CE credits in the state, we do have to pay for those. So that is an option at the end of the modules if the learner wants them. And it's good for 10 contact hours, which is a great opportunity for nurses to keep up their continuing education. So after piloting the course at the end of year 2, around 2023, we evaluated the module and modules and continue to evaluate the pilot of the modules with Kirkpatrick's four-level model. For level 1, we asked whether the course was relevant, useful, and worth the time of the learner, and we found a statistically significant and resounding yes. For level 2, we asked whether the course led to an increase in skill or knowledge, and if the course met the required cognition level of the learner. And we also found a statistically significant and resounding yes. You can see here some of the qualitative attestations from our learners. And I will be sharing a few more of those throughout the presentation as we go. But as Amy had said earlier, we got some amazing feedback and really positive feedback from the pilot at Geisinger. So some additional outcomes that we can share for the pilot are that as of June 2025, 659 nurses have enrolled and 254 have completed the CFPA 101 course, including both preceptors and faculty. Again, we found significant quantitative data using Kirkpatrick's model of evaluation and positive qualitative feedback from the end of course surveys that show that the CFPA 101 is a valuable, well-designed resource. And I just want to point out, and I see that Mindy has popped into the chat to say the CFPA is the Clinical Faculty Preceptor Academy, which is what it's called. Large health systems have adopted the CFPA for training their staff to be preceptors, and academic institutions are using the CFPA 101 as part of their orientation for clinical faculty, as well as incorporating it into the Master of Nursing of Education curriculum. Here's some more responses from surveys post-course that I wanted to share with you all. And I want to just point out this first one, which is, I've been a nurse for 28 years and reflect on some experiences with the students. Teaching is different than just doing nursing. And I know Amy touched on that when she said that you can be an excellent nurse and be expected to step into the role of preceptor or educator, but there are specific skills that go into that role. And this Clinical Faculty Preceptor Academy aims to address those skills for people that want to be preceptors or clinical instructors. Teaching strategies and communication are very important when in the role of a preceptor to nursing students. Role transition and self-reflection help to prepare a clinical nurse to be a preceptor, as well as reflect on what can be improved. And one of the modules where that's really evident is where you have to come up with a faculty sort of a faculty description or role for yourself and develop your own teaching philosophy. Okay. Lastly, to further incentivize learners, we created a financial incentive study. This is funded from the HRSA grant that Amy described, and the funds support clinical faculty and preceptors who precept undergraduate nursing students. The study aims to examine the impact of a financial incentive on the willingness to serve in a clinical faculty and a preceptor role for undergraduate nursing students. This pilot program is just finishing up here in year 3, and we're hoping to have an extension into year 4 of our grant. Right now, clinical faculty and preceptors are both eligible to receive the financial incentive. For clinical faculty, it's a $200 per semester stipend, which is not contingent on completing the CFPA 101 course. So they sign up, we ask them to review it. If they decide to complete it, wonderful, they get their $200. If they decide not to complete it, they still get $200 for assessing the opportunity. Preceptors get the same opportunity. They get to access the course, and if they decide to complete the course, they get an additional 4-hour incentive for hours that they spend precepting undergraduate nursing students after they finish the course. If they assess the course and they decide not to complete it, or it's still in progress during their precepting hours, they receive a $2 an hour incentive for those precepting hours. So I know Amy touched on this, but I'm going to bring it up again. And that is, who is the CFPA aimed at? And that is healthcare organizations. So hospitals, places that are hosting nursing students, academic institutions. So it's been incorporated into the curriculum for some student clinical faculty, and also individuals. So individuals who are precepting, if they're interested in expanding their knowledge about education and being a preceptor, or just interested in professional growth, or want to feel more confident in precepting or being a clinical educator, individuals can sign up to take the course as well. All right. During rollout and dissemination, we recognized that we could reduce barriers to adoption of the CFPA with a planning grant for interested institutions and an implementation toolkit. So the planning grant was given to 4 sites with $12,000 each as a stipend to help offset the cost of developing and regularly convening the implementation team to prep for replication of the program at their site, including staff time, meeting materials, working with platforms that they may have for payroll, et cetera, to accommodate the program rollout. Sites were given an implementation toolkit, which supported them to set up their facility for the financial incentive, determine who was eligible, establish a communication plan, get in buy-in from leadership to support the course, and be able to promote the course to employees, reach out via flyers, emails, posters, and fact sheets about the course so that their employees would be excited and interested in signing up for the CFPA. And then lastly, we had to establish a system for data tracking. And so we gave a spreadsheet template to the implementation sites so they could track who had signed up for the course, who completed the course, and who was owed which financial incentive. All right. As Amy said, we're currently finishing up grant year 3, which included quarterly meetings of our full advisory board, a marketing campaign, website, flyers, social media, explaining the CFPA, as well as attendance at conferences and presentation of the work that we've been doing, the financial incentive study, and free access to this course for any healthcare or academic institution in HRSA Region 3 or individuals in HRSA Region 3. And that also includes the implementation toolkit. We're really looking forward to year 4. We're going to make the course widely available outside HRSA Region 3, so nationwide. And then the second piece of really exciting information is that we're in development for a 201 course, which is aimed at advanced practice providers who are precepting or clinical instructors. And that should be becoming available in October. So very, very soon. And in terms of sustaining this program in the future, once the grant funding ends at the end of year 4, we will continue to make the course available across the country for a small fee to ensure the cost of licensing fees, the CEU maintenance, because it's very important that we be able to offer those education credits for people who take the course, and as well for the faculty support and review of the course materials. There'll be group rates negotiable, and we're really excited too about future work to be done and to continue to develop this exciting learning resource. All right, thank you so much. I'm going to pass the program back over to Kelly, but if you're interested in learning more about the Clinical Faculty Preceptor Academy, you can scan these QR codes to learn more about that or about the Nursing Workforce Coalition, which is who Amy and I represent. And you can also email us directly at cfpa@geisinger.edu.
Thanks, Amy and Anna. This concludes the slide presentation portion of our program. Now we'd like to begin our question and answer period. If you have questions, please type them in the chat box on the right side of your screen. You can click the chat icon in the upper upper panel of your screen, and we'll try to answer as many questions as we can. I know there was a question that came in, and I think this was responded to with communication, especially difficult communication being such a high priority. Is there any active practice around crucial conversations as part of this training, or is everything online? And it looks like Mindy had responded to that about portions relating to crucial conversations that are very realistic and provide feedback. Do you have anything else you would like to add?
So I thank you, Mindy, for responding to that. What I will add is that despite the fact that the curriculum is completely online, it is built in such a way that it will absolutely compensate for the learner who may not have the best responses to the questions and the interactions as part of the curriculum. There is also I'm going to call it the capstone at the end of the curriculum, where the learner is expected to express their philosophy on learning and really articulate how they synthesize the information and how they're going to put that into practice, which is very different from most online classes and takes the learner to that an advanced level. So although I know what I know what we're getting at with having that one-to-one feedback, I just wanted to mention that it really does a nice job in the despite being all online.
Absolutely, Amy. And it also forces you to write your own scripts for difficult conversations and to, post your own responses when things get difficult. It's very immersive. It puts you in the role of the preceptor and goes over difficult conversations you may have to have within the hospital facility where you're working. Conversations or situations you might encounter with students, maybe students who are doing things they're not supposed to, who aren't right, or who, for example, aren't recognizing the safety of the patient. There's a specific instance I'm thinking of where a student in your clinical group puts a patient at risk for falls, and you have to handle that situation by typing in, how you would communicate with that nursing student, and then it continues throughout the scenario. So very specific and very realistic opportunities to address difficult conversation.
Thank you both so much. That was some good information. There is another question here. Have you been able to evaluate the safety data before and after implementation? And I think, again, your colleague Mindy provided a response here. It's kind of early to be able to give that type of answer. Do you have anything additional you'd like to share?
Unfortunately, not at this time that would answer all the questions.
There's another question here. What do you think about the loss of financial compensation once the grant runs out? Do you think that there was a big driver for learners? Has this been successful for others without the compensation?
I can address that. We're still evaluating the impact that the financial compensation had. But initially, it doesn't look like it made that much of a difference. And so we can look at that two ways. In one way, it it may be that it didn't make that much difference. Maybe we weren't offering enough, but also on the other hand, that people were willing to interact with this information regardless of the financial compensation. There were a lot of people who even took the course and didn't bother to register for the financial compensation. So I think there's a lot of space there for us to look into the reasons why or why not the financial compensation didn't seem to play much of a role in people's interaction with the course. Um, you know, Subjectively, I definitely heard from a lot of learners that they accessed this information because it made them feel stronger as a preceptor, and it addressed anxieties that they had about their role, legal aspects of precepting, and other important information that they weren't finding elsewhere. So I think there's a lot of motivation for people to access this course regardless of the financial compensation.
Interesting insight. Thank you. Amy, were you gonna say something?
I was just going to add that I think that it's really fascinating that was one of the pieces of information that we've gleaned from this process, that we have really driven home the lack of compensation for our preceptors and faculty. And it seems when it comes down to it, they're more hungry for the knowledge than they are the money.
Great, thank you. For those of you who do have questions and haven't put them in the chat box, please feel free to type in any questions that you do have. I know there's been some responses in there as well as the resources. So if you're more interested in some more information, again, some of those links are right there in the chat box. We have a few more questions. How do you keep the information current in the CFPA as knowledge evolves?
That's a
That's
great
one place.
question.
Oh, sorry, go ahead.
Please, Anna, go ahead.
I was going to say that's one place we really have had a wonderful experience with our advisory board. As I mentioned, we're starting to getting ready to roll out a 201 course, which is for advanced practice providers. Not that the 101 course is not also valuable to advanced practice providers, but we really got the feedback that advanced practice providers had some unique needs, and we wanted to develop a course specifically for them. But our advisory board is willing and available right now to review content, update content, and we're also getting feedback from learners. If a link doesn't work or anything like that, we're actively updating the course.
Great, thank you. Can you provide some clarification there? We've been talking about this possible grant extension. So what is the current state? Is it free to use currently, or do you have to accrue a cost to utilize this?
So it's currently free to use in HRSA Region 3. So we are going to be rolling it out nationwide, and there will be a cost associated with that. If you're outside of Region 3, we're trying to keep that cost as minimal as possible, just to keep things, up to date, such as accreditation for the CEUs. The course itself is free, but if you want the 10 CEUs, you do have to pay the CEU fee of $15. I hope that clarifies.
Thank you. And then can you describe how would I sign up for the CFPA?
Absolutely. So if you follow the QR code that we put on the presentation, you can sign up for the CFPA there as an individual. And then I can also put a link in the chat.
Great. Thank you so much. All right, we have another question here. Could you provide an example of the process a nurse would follow to complete this course? You mentioned that it is asynchronous, but also that it includes a summative evaluation and the development of a teaching plan. Additionally, could you clarify the expected time frame for a nurse to complete all 6 modules?
Great question. I know we didn't address time frame, so I'm glad that you brought that up. Right now, a nurse would click on the link to be interested in the course, and I've seen that Jennifer was kind enough to drop that link in the chat for us. and sign up. There's a little survey in the beginning that asks, who you are, what level of education you have, just some demographic information like that. And then you are enrolled on Canvas, which is our learning platform. You do the course asynchronously. Right now, you have about 3 months to take the course, and it's 10 hours of nursing education, but it would take, probably depending on how intensely you were involved in it, anywhere between 6 and 10 hours to complete the coursework. That's just the asynchronous coursework. And then at the end, I would say it takes about an hour or so to do the assignments, and then they're submitted for review to Geisinger faculty, and they'll get back to you with comments and a passing or failing grade.
Are you able to comment, because somebody put in here about clarification that we're in Region 3, what all is included in Region 3, and are these the individuals on this webinar, are they able to just share the link for registration with staff?
Yes, absolutely. You can share the link for registration with staff. If you want some support, like if you're planning on letting your whole staff know, we'd be happy to send you the implementation toolkit or some aspects of that to help get the word out, flyers and other things that you could share with your staff. So you can email us at CFPA at geisinger.edu. And HRSA Region 3 is Pennsylvania, Delaware, Maryland, West Virginia, Virginia, and District of Columbia. And thank you for sharing that slide again. I was just pulling out that information. But yes, if you'd like some support in enrolling a larger group of people, we were happy to help you with that. And of course, keep up contact, because when we do reach the end of our grant funding, we will be making packages available for larger institutions who are interested in sharing this course with like their entire faculty cohort or preceptor cohort. And there's the email that I mentioned, cfpa@geisinger.edu, in the chat.
Yeah, I wanted to share that map. It is a little difficult to see, so apologies if our participants want to pull up their presentation that was in their email confirmation or whatnot, or I think it is in the chat box probably near the top. You would be able to pull that up and probably get a little better view of that. Again, contact information, here you go. Certainly, if anybody would like additional information, there's the email that we just referenced. It looks like there's a question about would this be for anyone that might precept, not just those that are actively precepting undergraduate students?
Absolutely. It's absolutely it's just as continuing education and professional support for those who are considering being preceptors or thinking about going into nursing education. It's a great start.
And how about appropriateness for advanced practitioners?
It's definitely appropriate for advanced practitioners because it covers a lot of basic foundations of learning and education that we don't necessarily get as part of a master's in nursing or curriculum. But we are, which is very exciting, coming out with a specific course for advanced practice nurses hopefully in October.
And what about other healthcare professionals other than nurses? Would this be appropriate for those individuals?
I would say so. I think it does have an acute care nursing focus, but I think I found that it's applicable to educating healthcare professionals in any setting, because it focuses on those key aspects of legal aspects, communication, roles, and teaching and learning theories that are applicable to learning in any environment.
There's a lot of great questions coming through. If there are any final questions that you have, please feel free to type them in the chat panel. We will be wrapping up shortly here if nothing else comes through. It does look like another question did come in. Do any of these modules focus on educating a nurse resident to precepting a nursing student or extern?
I don't think that scenario is specifically encountered in the modules, but that the the course initiatives and ideas cover the same things that a nurse resident would need to know. So anyone who's new to a role as a preceptor or as a clinical instructor can benefit from these modules. This is more
Yeah,
about the role of the teacher. Sorry.
Great answer, and I completely agree with you. Wanted to speak to Sherry's question, and that I can tell you that Geisinger has actually implemented in their nurse residency curriculum at the end, I want to say month 11, that they are taking this curriculum in preparation for knowing that these nurse residents are going to be precepting nursing students. So they have baked it into their nurse residency program, which I think was quite brilliant and is working very well for them.
Do you want to just quickly maybe explain if there's anybody participating that doesn't understand what nurse residency means? Can you quickly kind of
Sure.
define that?
Absolutely, Kelly. So, nurse residency is considered a separate program from orientation, where we're very familiar with the orientation process of a nurse, whether that is a relatively new nurse graduate or a seasoned nurse, in understanding the ins and outs of the unit that they've been hired on, and policies and procedures. Residency is designed for that initial professional job outside of nursing school, where in addition to being oriented to the unit they've been hired for, they go through a year-long program that will really help prepare them for the professional nurse role. So it's a lot less about the how-tos and a lot more about professional development, always thinking about evidence-based practice, quality and safety, and how the professional nurse role fits into the organization of healthcare. So they are typically, and this varies between programs and curriculums, but 1 year. And again, it occurs in the middle of or towards the end of the orientation process. So we're really meeting, and this is a classroom setting, but a very interactive classroom setting for that 12 months.
Great, thank you so much. Do either one of you have any final words of wisdom before we wrap up? We're coming to a close, and I don't.
I will say that I believe what has been created is an answer that many of us have been looking for. There are products you can purchase, there are homemade products, and we're all trying to solve the problem of preparing individuals to, I'll say, care for our nursing students, one, to keep them in the profession, but also make them the best that they can be. And I feel like this curriculum is really the answer to that. And very grateful for the HRSA grant, that it is free for our region. And as I had mentioned in the chat, if additional funding is not secured, it will still be at a nominal fee to be able to maintain what has been created. So it is, in my opinion, one of the answers that we've all been searching for. And there's a lot of resources and individuals who will help make it successful for you if it's something that you're interested in pursuing.
Great. Thank you both so much for this wonderful information. It sounds like a great resource for healthcare facilities to utilize. If there's no additional questions, one last chance to use the QR codes here. Also keep track of that email address to get in touch with them if you have any additional questions. I want to thank everyone for joining us today. If you experience any issues accessing the evaluation or CE certificate, please contact Shelley Mikesell at shmixell@pa.gov. This concludes our webinar. Thank you.